Hello everyone, I'm Dr. Qi, and I'm from the Department of Traditional Chinese Medicine of the First Affiliated Hospital of China Medical University. Today I will give you the class about acupuncture treatment of facial pain. Okay, let's start with the preface of facial pain. Facial pain refers to the disease syndrome with severe facial pain on one side or accompanied by spasm, painful cheek pain, equivalent to trigeminal neuralgia. It is a recurrent and severe neuralgia in the trigeminal nerve distribution area and is one of the common diseases in neurosurgery. The examination of the primary person generally has no positive signs, and all laboratory examinations have no abdominal findings. Secondary ones can find pathological changes in the corresponding parts. There is a history of transient and recurrent pain, sudden onset, no aura. The pain is severe, cutting, stabbing, burning, tearing, and throbbing, mostly on one side of face, rarely bilaterally. Prone to elderly patient is 40 to 60. The cause of disease is cyclical, with episodes lasting from a few weeks to a few months, and periods of remission varying in lesson ranging from a few days to several years. There are many plate melting points, often triggered by the above-mentioned triggers. Clinical involvement is most common with the second or third branch. Pain is the most pronounced in the cheeks, upper and lower jaw and tongue. Touching these sensitive areas can trigger a painful attack, which is known as a plate melting point. And part 2, the cause of disease. The TCM can be divided into the following causes: external evil, infestation, wind chill, cold, pathogenic, stagnation, blocking meridians, wind heat, burn body, fluid, and block qi and blood. Attack on the facial meridians. If not clear, it will hurt. The sun is shining and the fire is burning brightly. The stomach and the intestines are hot. The fire of Yangming is resting up the face, and the muscles and veins are blocked by qi and blood. And the blood stasis and the internal obstruction. And the long-term illness not healing or internal stasis of blood, stagnation of qi and blood stasis, and the blocking of the meridians, and asthenia of fear, old age, weakness of the liver and the kidney, deficiency of yin and yang, and the hyperactivity of the yin and yang, rising fear of deficiency, and the blocking of qi and blood due to facial muscles and veins. And part 3, clinical presentation and tapping. The characteristics of trigeminal pain are sudden, severe pain. Each episode may last for a few seconds or 1 to 2 minutes and may occur several times a day, often triggered by washing your face, brushing your teeth, eating and talking. The lateral muscles of the disease were tracing, tearful, runny, and salivating. Skin or flapping and localized pressure in the area of trigeminal nerve distribution on one side of the disease. The syndrome differentiation and tapping. Trigeminal neuralgia can be divided into 5 types: deficiency in yin and high fear state, of intense deficiency. Cryptic pain, flushing on cheek, face, dry mouth, hot hands and feet, red tongue, little mouth, thin pulse, and wind and cold. Most of them have a history of cold wind. The painful part is even worse when they encounter cold. The heat is reduced, the tongue is light, the mouth is thin and white, and pulse is tight. Evidence of wind and fever, mostly after a cold and fever, with a burning sensation in the sore spot, redness in the eyes, thin yellow mouth and floating wings. An asthenia, affair with bad breath, thirsty, constipation, red tongue, and yellowish mouth and pulse tongue. Bronchitis and internal obstruction. The painful spot does not move, refuses to press, and the lingering is difficult to heal. And the tongue is dark, wings are astringent. And part 4, acupuncture treatment. The basic principle of acupuncture in the treatment of facial pain is stretching the wind and clearing the ligaments, activation blood and relieving pain. The main points we choose if pain at supraorbital region, choose Yangbai GB14, Yuyao, Chuanzhu BL2. If pain at maxillary region, choose Sibai ST2, Quanliao ST18, Yingxiang LI20. If pain at mandibular region, we choose in Xiaguan ST7, Jiache ST6, Daying ST5, and Jiachengjiang. The selecting matching points according to the elliptical classification. We can choose Hegu, the diversion of yang, ning, qi, and blood to relieve pain, and Fengchi GB20, dispelling the wind and clearing the ligaments, and activating blood and relieving pain, which is suitable for wind chill type. Lique LU7, to eliminate wind so as to stop pain. And Dazhui GV14, good at subduing heat, which is suitable for wind heat type. If it is facial pain of blood stasis type, we choose Taichung LR3 and Sanyinjiao SP6 to promote blood circulation and remove blood stasis. And other characteristic acupuncture therapy. The first one is auricular points therapy. Select points liver, yang, shenmen, cheek, jaw, stomach, liver, and kidney. Operation should acupuncture is recommended during attack period, and ear pressure is recommended during the relief period. The second method is electric needle. The Ashi points are the acupuncture points, or the prescribed selection of acupuncture points. Also, we have cupping. To puncture with a triangular needle, followed by the flat scan method. In this video, prick and bleed the temple point and cooperate with local cupping therapy to activate blood circulation and remove stasis and improve nerve function. We also have a method which is called press the needle. Press the pain at the trigger point twice a week. This method has long needle retention time and a strong agonistic effect. Okay, now let's give a summary. For better prevention and treatment of trigeminal neuralgia, You should keep your mood comfortable and avoid emotional excitement. Pay attention to rest and exercise properly. During the remising period, the face can be wiped with cold water to enhance the face's ability to resist wind and cold. Avoid spicy food and hair, and ban tobacco, alcohol. Acupuncture has good analgesic effect, medical history, and distinguished primary or secondary. That's all for today's class. Thank you.